Herbal topicals in pain management, a narrative review of recent clinical trials and key considerations for future studies is a study led by Fatemeh Hassani from Student Scientific Research Center, Tehran University of Medical Science, Tehran, Iran. The primary objective of this review was to examine clinical trials investigating topical herbal agents for pain management. We focused on identifying methodological limitations, inconsistencies in findings, and important considerations to guide future research in this field. Pain is a global health concern, affecting approximately 1 in 5 adults worldwide. Traditional systemic therapies, such as NSAIDs and opioids, often produce adverse effects due to high systemic absorption. Topical plant-based preparations have emerged as a safer alternative, yet their mechanisms of action remain incompletely understood, necessitating rigorous evaluation of existing clinical trials. A non-systematic literature search was conducted across PubMed, ScienceDirect, and Cochrane, using 74 relevant keywords. From 3,316 initial records, 1,683 were screened for publication dates between 2017 and 2025. Of 140 clinical trials identified, 56 met inclusion criteria. Data extraction and synthesis were structured according to the Joanna Briggs Institute checklist for narrative reviews, emphasizing topical application, pain outcomes, and methodological quality. The most frequently studied herbal topicals were capsaicin, appearing in 34% of trials, and menthol in approximately 11%. Less investigated agents included licorice and arnica, each represented in only 1.7% of studies. Pain assessment tools most commonly used were the visual analog scale and the numerical rating scale, reflecting standardization challenges across trials. Findings on menthol, capsaicin, and aloe vera were sometimes contradictory, suggesting variability in formulation, dose, or study design. Nanogel formulations enhanced absorption of curcumin and clove eugenol, demonstrating potential for improved efficacy. Negative interactions were observed when menthol was combined with capsaicin, diclofenac, or methyl salicylate, highlighting the importance of assessing herb-drug interactions. Other common limitations included challenges in blinding due to distinctive odors or colors, and a lack of long-term follow-up. In summary, herbal topicals such as capsaicin and menthol show promise for pain relief, yet the evidence is limited by methodological inconsistencies. Future studies should prioritize standardized formulations, robust blinding techniques, careful evaluation of potential herb-drug interactions, and long-term safety assessments. Such improvements are essential to establish reliable clinical recommendations for topical phytotherapy in pain management. Thank you for your attention.